we're talking about the ischemic stroke. Ischemic stroke meaning the stroke occurring due to decrease of blood supply of brain, hypoxia of brain leading to development of stroke. Ischemic infarction is due to interruption of blood supply to the brain, either by blocked vessels or leakage of blood. Blocked vessels meaning the vessels will be blocked by thrombosis or embolization, and this is the most common causes of ischemic stroke. Most common is blocked blood vessels. The other is leakage, meaning the patient have severe hemorrhage, so this will be causes hypoxia of all the body, and when the organ of the body will be affected is brain. Okay, now why we do the radiological investigation in patient with a stroke. يعني مثل ما احنا نعرف الستروك can be diagnosed clinically. فالبيشنت من يجينا للراديولوجي يجي مشخص انه the patient have مكتوب acute stroke. فwhy we do the radiological investigation in patient with acute stroke? First, to exclude hemorrhage. Okay, because the stroke is have two types. Either it's hemorrhagic stroke occurring due to hemorrhage, as I mentioned in previous lectures, the intracranial hemorrhage, the subarachnoid hemorrhage. This will be caused stroke, or occurring due to ischemia, decrease in the blood supply. And you know there is a completely different in management of the patient with hemorrhage and the patient with ischemia. يعني المانجمنت مالتنا تختلف 180 درجة ما بين البيشنت اللي عنده هيموريج والبيشنت اللي عنده اسكيميا. فإذا الفيرست ايديا من إنه إحنا ندز المريض radiological examination إنه إحنا نحاول نميز إنه هذا المريض عنده ischemic stroke لو عنده hemorrhagic stroke. هاي number 1. Number 2, to differentiate it between irreversible affected brain tissue and reversible impairment tissue. What does that mean? That means when the brain affected by hypoxia in the first hours, first 6 hours, first 12 hours till 24 hours, the brain tissue have impairment in function, but it's still alive, not dead. So when we relieve the causes, we relieve the obstruction, relieve the stenosis, relieve the thrombosis, and return the blood supply to the brain, this brain tissue will be returned back to normal function. Understand me? This is what I mean irreversible impairment. يعني الدماغ أول ما راح يتعرض إلى الهايبوكسيا راح يصير impairment بالفانكشن مالت الدماغ، بالفانكشن، بس لا زالت النيورون سيلز it's alive. So من نرجع الأكسجين، نرجع البلد سبلاي نورمال، نسوي انترفيو، عفوا نسوي انتربريتيشن، ننطي للمريض مانجمنت، نفتح الأوبستراكشن، نمشي البلد سبلاي للبرين، راح ترجع البرين فانكشن نورمال. فراح نحول المريض من هاند كاب إلى نورمال. هذا اللي هو reversible impairment. While irreversible impairment meaning إنه there is permanent damage in the brain occurring due to long time ischemia. أكثر من 24 hours ischemia راح يبدي يصير عندنا brain tissue dead، فيبدي dead بالbrain tissue وتبدي مرحلة الجليوتيك change اللي هي irreversible. فمعناتها هاي المرحلة راح يكون المريض handcuff. فإحنا من نشوف هذا الشيء راح نقول للأهل هذا المريض handcuff وراح يبقى handcuff. This is the second. The third, identification, stenosis or occlusion. Diagnosis للcauses مال obstruction. If it is stenosis, if it is occluded by thrombosis, by emboli, and we can do embolectomy, how we can do thrombotic change, stent for this patient, the type of stenosis, size مالته نقدر نعرفه من خلال radiological investigation. إذن first we exclude hemorrhage, Second, differentiated between reversible and irreversible brain tissue damage. Third, to diagnose the site and number and size of stenosis or occlusion major blood vessels. The first image we do for the patient is a CT scan. CT scan is the radiological choice for the patient with a stroke, as we mentioned in first lectures. Now, in ischemia, بالacute stage, the brain tissue appearing normal in CT scan. Normal in CT scan. Okay? بالacute stage, ischemic change اللي هو أول 24 hours راح يكون البراين tissue completely normal, or maybe there's minor in face muscle side, minor edema, but in general it's normal. change راح يبدي بالبراين شو وقت راح يبدي بيه بالسب acute stage اللي هي تبدي من السكند داي إلى 10 أو 2 weeks. خلال هالسب acute stage راح يبدي الراديولوجيكال change يطلع بالسيتي سكان. فبالنسبة للسيتي سكان radiological sign of infarction is first is hypodense area. Hypodense meaning is black area سوداء. Hypodense area must involve a gray matter, must involve a gray matter and white matter. The white matter involvement by edema, the gray matter involvement by ischemia. Then its hypodense area involvement gray matter have which shape and involvement area of territories of blood vessels. Look for this picture. This is the imaging of CT scan showing hypodense area, which shape involvement cortex, white matter and gray matter. Okay, as we can see, it is in the right temporal lobe associated with edema. As we can see, there's compression upon the adjacent lateral ventricle, compression. This diagnosis a subacute infarction. Subacute infarction. As we can see, the right temporal lobe is normal, right occipital lobe is normal, the involvement only right frontal lobe is normal, right occipital lobe is normal, the involvement only is right temporal lobe. Involvement in territories of artery. This is the territories of middle cerebral artery. This is the sign of infarction. In chronic stage, when the damage continuous, there is a progressive in decreased density, progressive in hypodense until the density approach to CSF. And there is a shrinkage of brain tissue. Shrinkage meaning the brain tissue is become smaller. Okay, this is the gliotic change. Gliotic change, relief of edema, relief of mass effect, meaning the brain tissue is dead. فمن تروح الإديمة وتروح الماس إفكت معناتها التشو اللي أندر إلها بدأ يصير بيه gliotic انتهى. فهذا هو irreversible change اللي هو chronic infarction. But this is the CT scan of brain showing hypodense area involvement left temporal lobe associated with gliotic change. Gliotic change. As you can see, there is no mass effect, no edema. This is the chronic irreversible infarction. Sign of infarction in MRI. In MRI is more sensitive and more specific into the diagnosis of ischemic stroke than the CT scan. So, when you have the patient ischemic stroke, first idea for the diagnosis is the CT scan, but the follow-up of the patient doing by MRI, either to exclude underlying causes like the blockage or occluded in the blood vessels by doing the MRA, or follow-up of the patient if there is enlargement infarction appearing other area of infarction, the infarction will be better, the infarction will be worse, the follow-up doing by MRI. In MRI, the infarction area appearing hyper-intense in T2, white matter and gray matter. As mentioned in the CT scan, there is edema and mass effect. In this picture, we see there is axial view, MRI, of a brain, T2 weighted image, and the other it's a FLAIR weighted image. T2 weighted image showing there's a hyper intense area involvement left temporal lobe. As you can see, there is a gray matter and white matter involvement associated with mild mass effect and compression upon adjacent ventricle. This is the subacute infarction. In chronic, the progressive damage to the brain, relieve edema, relieve mass effect, the brain becomes smaller, and the intensity of gliotic brain approach to CSF fluid as mentioned in CT scan. Looks for this area. This is the T1 and T2 weighted image, axial view MRI, showing there is a right temporal lobe chronic infarction. Why? Because the intensity of the brain tissue reaching to CSF density, and there is no mass effect, no edema. This is the impairment damage of a brain. This is the chronic infarction and impairment damage of a brain. Okay, this is the small homework for you. I hope to answer me. أتمنى تجاوبوني، وأتمنى أعرف أسئلتكم والشي ما فاهمي أنا مستعدة أجاوب عليه. Good luck and thanks for your patience.